The World Health Organization says the persistent shortage of vaccines will impact on efforts to contain cholera. Southern Africa is battling an outbreak of the waterborne disease, with Zimbabwe, Malawi and Zambia mostly affected. Last week in Limpopo, that's here in South Africa, that province confirming 2 cholera cases from Zimbabwe in an effort to curb the deadly outbreak. Red Cross is hard at work trying to promote access to clean water in cholera hit areas. Let's get some detail now as to what to do if and when cholera is announced in your neck of the woods. And let's speak now to the head of programs at SA Red Cross Society, Ireene Mutombwa-Shumba. Ireene, good morning to you, and thank you very much for your time. Let's first deal with cholera in South Africa. How worried should authorities be here about its possible spread?
Thank you, Coley. There is need, of course, for preparedness actions to be embarked on, and anticipatory actions also with regards to the threat of cholera when it comes to the South African context. Looking at the nearby countries that are affected heavily with cholera right now, and South Africa's position as a migration hub, we really need to ensure that we are prepared as a country.
Yeah. I listened to the spokesperson of the health department, and they were asked a specific question as to, do we know how many cholera cases we actually have in the country, apart from the 2 known ones that seem to have emanated from Zimbabwe? And the response was, we actually don't know whether we have more cases, and the reliance is on people if and when they suspect they may be experiencing symptoms to immediately go to the nearest healthcare center. What symptoms should people look out for?
Of course, when it comes to cholera, you are looking at symptoms like fever, sometimes high temperature, also running tummy, diarrhea. But of course, much emphasis at the moment is, instead of waiting for symptoms, we need to do anticipatory actions, which involves raising community awareness in that regard. We are looking at risky communication and community engagement to ensure that our communities are aware on what to do to prevent them from contracting cholera. I think that is key.
Yeah. The countries we have mentioned in the southern tip of the African continent, Ireene, Zimbabwe, Zambia, Malawi, the cholera cases have been quite intractable there. Why is that?
Of course, when it comes to cholera, infrastructure plays a great role in ensuring that at least people have access to safe drinking water. So there's really need to ensure that infrastructure is in place, and looking at the different countries. Also, you know, cholera is transmitted through consuming contaminated food and water. So there's really need to ensure that the community is knowledgeable in ensuring that they need to be sure that the food they eat is well cooked and the water they drink is clean.
Clean sources of water.
Yes.
They may be a difficulty to come by in some areas. What are the tips, therefore, for people to at least make sure that once they ingest that water, it has been purified somewhat?
Normally, when people are not having a safe source of water, they need to ensure that they treat that water to ensure that it is clean. So the traditional treatment of water can also involve utilization of a jig in ensuring that the water is safe for drinking.
Then the flooding situation, or should we say the floods situation. that seems to be going up and up in South Africa. If we look at KZN, for example, lots of water is coming down. Does that compound the situation in trying to contain the cholera spread, or is that actually a positive?
Of course, when there are floods, there's a worry, especially with the threat to waterborne diseases. And we can't spare cholera either. But then, like I highlighted earlier, what is important is to raise community awareness to ensure that when they access water, the water they access is clean and safe for drinking. If it is not from a protected source, then it needs to be treated to ensure that it is good for human consumption. That on its own will help us to ensure that we curb such cases for cholera if they are to occur.
Earlier, when I began the conversation, cholera, it's described as a waterborne disease, but it's also deadly. That then brings into question the element of vaccine availability. How much of it do we have in all these countries that we've mentioned, by the way?
Colleague, I will not be in a good position to answer that question. This should come from the health authorities, as they are the custodian of health issues in different countries.
All right. And so yours as Red Cross is to raise awareness, but beyond that, how else are you helping the communities?
Of course, besides raising awareness, we also intensify our engagements with our partners, including the government, because as Red Cross, we are also an auxiliary to the government. We complement government's effort. So where there are gaps, that's where we can also see how we can lend a hand. But also we ensure that we serve the communities, we have the community's interest at best. So obviously we also enhance our partnerships, be it with community radio station, different platforms that we can maximize on in sensitization of communities, promoting good hygiene practices in different communities so that at least we can curb the outbreak if ever there's any.
All right. Ireene Mutombwa-Shumba, thank you very much for your time. Head of Programs at SA Red Cross Society. So please be on alert.